This is a session that unfortunately Joanna Maria Glicor just pointed us that she was delayed in another meeting. She's not going to join. So it could be a session that we could do almost in Portuguese if it not for the presence of our many foreign friends that are here with us. So basically this is a warming up of a theme that it's going to be of extreme importance these days. Fighting COVID with mobile apps. I just really know today that the Spanish government is starting an initiative on this sense. So I would like to have the initial impressions from the two persons that are so important in terms of the scene here. It's Domingos Pereira is the Chief Information Officer of SPMS, the digital arm of the Ministry of Healthcare, as we already heard this morning, Honorable Lino Madeira, to mention that SPMS is the shared services of the Ministry of Healthcare is the digital arm of the healthcare, and Engineer Domingos Pereira is the Chief Information Officer of this organization. Thank you so much for being here. I know you have a busy schedule and it's really a pleasure to have you here for these initial comments. And also with us is Engineer Lino Santos, is the head of the National Center of the Cybersecurity, which is the maximum authority in Portugal for cybersecurity. And we could not have two better opinion leaders or healthcare leaders. In this case, Engineer Lino Santos is more broader than healthcare because it's cybersecurity regardless of the sectors. And it's really a pleasure also to have you here, Engineer Lino Santos. Thank you so much for taking your time to join us. And without further ado, Engineer Domingos Pereira, what will be your impressions, general impressions about the mobile app to fight COVID-19? Is this possible or just an illusion?
Well, we have some ideas about it. I would like to share with you 3 small slides that state the point as I see it. Let me see if I can share my slides. Okay, so we have nowadays we know that we can face the COVID-19 with 3 approaches: a group immunity, a drug, or a vaccine. And so far we cannot get the last 2, so we have to face the fact that we will have to have a group immunity to go on with our lives. So the point is, how can we do it with some control, allowing an exit strategy that allow us to go back to our lives without entering on a drastic new wave that put us all together in the same form of contagions. So we think that the mobile phones can help, and the apps we can do it with that can help on this care to allow us with a good exit strategy. But we know that this strategy includes also some risks, mainly privacy risks, that we should take care and think about them. But first, let me tell you how can we, what is the ecosystem of mobile use in Portugal. We are Portuguese, we like to talk. So it's clear that because we have a population of about 10 million of people and we have almost 16 million of mobile subscriptions. So we do like to speak by mobile phone, but we don't have so many smartphones. In fact, we have about 7 million smartphones, and there is also an indicator that allows us to think what can our people do with these smartphones. We have about 6 million people that use social media with their smartphones. That would let us think that some people, a gross part of our population can use an app and can use the smartphones to do their business with the apps that we allow. But in fact, we would say that only about 30 to 40% of our population will be able to use correctly an app that allow us to to get the proper consent to use it and to input health data and things like that. So the first question we have right now in Portugal is, can we prove efficiency with a coverage of 30 to 40% of population in terms of control of the spread of the COVID in Portugal and of course in other countries? So this is the first question I would like to put to our group. But later, there is of course other fundamental questions that we should endorse in any solution of contact tracing. First of all is privacy. Privacy is a different issue. For instance, I listened very carefully with Mahmoud's presentation, and I noticed that he was able in Scotland to integrate different data from different places, social care, healthcare, and other sources. So I wonder if in Portugal we can do it so easily with our privacy laws, which I think are almost the same of Scotland, but still it's a question. And of course, the next question is this technology, the contact tracing effectiveness in that is able to really control the propagation of the virus that we would like to understand and to control in terms of public health. So what is the place, what the things should our public entities do to control the functionalities and the amount of apps that tend to be created? Because in Portugal, right now, we know at least that, well, maybe 3, 4, 5 institutions from universities to other institutions are trying to develop solutions like that and are offering them to us in order to allow us to control the spread. So there will be an amount of apps, and the case is, should these apps be controlled by public entities, or should they let alone to the offering and to the choice of our people? And of course, data should be pseudo-analyzed. I mean, this has to do with privacy, of course. We should not allow that kind of tool to identify people that friendly tell us if they are effective and things like that. So, and in the end, we should probably have the insurance that after a while, data is destroyed locally or even centralized if that is the case of the solution. So what I would like to put on the table is this kind of issues, and have to see what our colleagues have to say about that and what are the challenges they also face in their countries. Thank you very much.
Fantastic. Thank you so much, Domingos Pereira, for being so brief and up to the point with this presentation. Maybe we can leave the slide later on when we are doing the World Cafe. Geraldine Santos, can you share your impressions about this mobile app to fight COVID? Is it something that it's within our reach? Can it be done? Like, I think in China already they have it, right?
Hello, good afternoon, everybody. I bring to this topic. I'd like to raise some issues. I don't have a presentation, sorry, but I think I'll be clear enough to identify some issues that need to be addressed if we want to have an application to trace COVID and to help us for a better return to normality. So the first thing I would like to bring is that we should focus on the objective of this application, of this mobile app. Technology can do a lot for us, and is rather easy to think to set up a mobile application and start with a small objective, and meanwhile this app can do a lot of things more. Well, in this case, I don't think this should be the best path, the best way to do it. We should focus on a very small, a very precise objective of what we want to do with this app. And I think there's a broad consensus right now on this objective, the main objective of this app. And this should be to help the citizen to understand if they belong to a chain of infection. So that is a very simple objective that can help us on this return to normality. So if we all have this app in a voluntary basis to understand if we belong somehow and somewhere to a chain of infection, and this is well, this should be the object. This is the first issue. The second one is that we have a couple of technologies that can do this. We have Bluetooth, we have GPS, and we also have metadata from communication operators. This is another issue where we want to actually stay very simple and focus again on the objective. We need to choose the most efficient technology to achieve this objective. And I think also in this matter, we have a broad consensus that Bluetooth, low efficiency, low energy messages will be the best technology to achieve this, and the less intrusive of privacy of the users. Then we have the process, third issue. We should design a process focused once again on the objective. The most secure process and the less intrusive process to achieve the goal. I think the European Union gave us some clues on how to do this and how to preserve privacy with the anonymization of the information that is shared without central storage of information, and with no correlation with information from other systems. This way we can achieve the objective and be less intrusive and preserve privacy of the users. Another issue I'd like to bring is about transparency. I think the whole process, and this is connected with the last point I want to bring here, the whole process should be as most transparent as possible. This means open code, this means scrutiny by the public, by the cybersecurity community, to see whether the code or the process involved in the application is actually doing what is meant to be and nothing else. And this brings me to the last and I think the most important at this point issue, which is to look at the cybersecurity of this app in a perceptual way. We can have the best solution, the best technology, and the most effective and less intrusive app in the world. But if the population understands it otherwise, this all will be a flop. This will not work, and we will not have a good perception on how to return to normality with the help of this technology. So it's more than actually being the most efficient app. We need a very good communication plan to help population to understand that we have actually the most effective and useful app. So whether the solution we have, whatever the solution we have, we need a very good communication plan to assure the population that this is a secure application. It only works for the purpose it was built for, and it preserves the privacy of the users. I think these are the 5 issues I would like to raise, and
there are very, very important issues, and I thank you so much, Engineer Lino Santos, because now we have a good framework from where we could start our discussions in terms of the Knowledge Cafe, as everybody will be involved in a short rounds of conversations right now. So